Assalamu alaikum and good evening all of you. Before starting anything, I would like to share a famous spiritual quote which I always use to amplify my abilities. It goes like Imam Ali Raza quote from his father Imam Musa Qasim. He quote from his father Imam Jafar Sadiq. He quote from his father Imam Muhammad Baqir. He quote from his father Imam Zainul Abidin. He quote from his father Imam Hussain. He quote from his father Maula Ali. He quote from the Holy Prophet Muhammad sallallahu alaihi wasallam. And he said, what faith is? Faith is knowing from your heart, expressing it through your tongue, and performing it with your organs. So whatever you do in life, faith is the basic necessity for everything. So continuing with the re-entry mechanism, there are some circuits or the focus of the re-entry mechanisms. That is, the re-entry is propagated from which center? So three centers are responsible for the re-entry. First is the atrium itself, second is the ventricle, and the third, which is referred as atrioventricular re-entry, in which both the atrium and ventricle are involved. So as a result of re-entry from, or you can say at the level of atria or through the atrial circuit, three types of arrhythmias are developed, which are atrial tachycardia, atrial fibrillation, and atrial flutter. At the ventricular level, when re-entry will be observed, the type of arrhythmia caused will be ventricular tachycardia. And when both the atrium and the ventricle will be involved in the re-entry mechanisms, the types of arrhythmias observed will be Wolff-Parkinson-White syndrome and supraventricular tachycardia. We will discuss each type of arrhythmia with its EKG representation shortly. But before coming to that, I would like to follow that arrhythmias are generally characterized with tachycardia rather than bradycardia. There is also the progression of bradyarrhythmias, in which there is decreased beat, generation or impulse within the cardiac system as a result of irregularity, but it is rare or limited exposure is observed of the bradyarrhythmias. However, the tachyarrhythmias are more common in comparison with bradyarrhythmias. So tachycardia is the most often characterization of the arrhythmias. So what are the reasons of the progression of the tachycardia? First of all, the re-entry mechanisms which we have discussed, that is the re-entry of the generations of the impulses and the beats that were propagated from the pacemaker are re-entered within the systems, through which we have discussed that through which centers or you can say through which level the re-entry mechanisms were observed. Second is the abnormal or the impaired automaticity, that is the generation of impulses spontaneously without the need of impulse generation, or you can say before one beat is progressed completely, the immersion or initiation of another beat is referred as abnormal or impaired automaticity. Furthermore, the triggered activity of the pacemaker is also a characterization for the automaticity, that is abnormal automaticity. Furthermore, a parasystole phenomenon is observed. Now, considering the parasystole, it is the mechanism of the generation of beat other than the primary pacemaker. As you all know that sinoatrial node is the primary pacemaker, but as a result of the degeneration or any sort of abnormality of the sinoatrial node, the pacemaker activity is carried or transferred to the atrioventricular node, and if they are also damaged or impaired, the pacemaker activity is then shifted with the Purkinje His system. But in presence of the primary pacemaker, the secondary pacemaker activities are not observed normally, but the parasystole is the phenomenon of the progression and generation of beats through the secondary pacemakers in the presence of the primary pacemaker. That is, the SA node is responsible for the generation of beats if it is normal or is not damaged. But due to the abnormality, the SA node is normal and is generating the beats, but due to the abnormality, the secondary pacemakers, that are atrioventricular node and the Purkinje His systems, are also developing their own beats, which cause this tachycardia and increased heart rate due to the generation of beats of all the pacemakers present. That is, both the primary and the secondary pacemakers are developing their beats, thereby affecting the rhythm of the heart. So the parasystole is another factor for the development of arrhythmias. So this is the classification or the types of arrhythmias. The arrhythmias are classified majorly into irregular arrhythmias and regular arrhythmias. For instance, the arrhythmias are themselves irregular, but depending upon the time interval of the beats, they are further classified into irregular and regular. Now consider this irregular type. There are irregularities present at the beat level, and the beats are also present in different time intervals. The time interval between these two beats is different from the time interval of these two beats, and further the time interval of these two beats is different from the previous beats. So the irregularities are present in an irregular pattern, that is, the time intervals are different. So if the irregularities are present in an irregular pattern, it is classified as irregular arrhythmias. And now consider this regular arrhythmias. Although the irregularities are present at the beat levels, but they are present in equal time intervals. That is, the time interval of these two beats is same as of these two beats and same as of these two beats. So the time interval or the pattern of the beats is same or similar despite of the presence of irregularities in the beats. So because of the presence of regular pattern of the irregularities, it is classified as regular arrhythmias, and the previous one was classified as irregular arrhythmias. So the irregular arrhythmias include a type which is known as atrial fibrillation, and the regular class is further classified into narrow QRS complex and broad QRS complex. Depending upon the QRS complex, if it is narrow, these three types of arrhythmias will be developed, which are sinus tachycardia, supraventricular tachycardia and atrial flutter. However, if the QRS will be broad or broadened, two other types of arrhythmias will be developed, which are ventricular tachycardia and supraventricular tachycardia with bundle branch block, which is also known as Wolff-Parkinson-White syndrome. Now we will discuss each type, its characterization and interpretation with the EKG.